Okay, so let's talk about something nobody likes to talk about, but we all experience or have experience with. We have this machine called Viveve, and I know that it's something that a lot of people find to be uncomfortable, but I myself have done it, and
I've done it.
I've done it too.
Yeah, and I mean, it wasn't bad, right? We all did it.
Well, first
We
of all,
did it
let's
for
talk
reasons.
about why you had it done. Like, why do women get that procedure?
Sorry.
Well, there's a
For
couple
me,
reasons.
Yeah. So for me, after just finishing with my breast cancer treatment, my cancer was estrogen, progesterone, HER2 positive, and so I have to be on hormone therapy. And the hormone therapy put me into menopause, and as when you have any type of those symptoms, everything kind of gets dry. And so lots of issues with that. It was painful to have intercourse, and on top of that, I found out that there was an additional benefit with the Viveve in that it helps with stress urinary incontinence. That's actually one of the things that you treat it for. And so I was like, okay, I get 2 for 1, and it ended up working really well. So, and I'll tell you what my results are after you guys tell what you guys got them for. So
For me, mine was after having 2 kids, things changed. So after, like going to trampoline parks, for example, with your kids, and, like after a couple bounces, I'm like, oh, okay, we have a huge problem here. So, that was a big issue for me, stress urinary incontinence. And so it was definitely life-changing for me. It's helped tremendously.
Yeah. So
So not just trampolines, I mean laughing.
Sneezing.
Laughing.
Yes.
Well, you can avoid the trampoline part.
That's right. But that is when I noticed it. Yes. So
Yeah.
laughing, sneezing for sure. But when I noticed it was big time was when I took the girls there. So
So
Yeah,
for
and
me,
working
when I
out.
would do CrossFit,
Yeah.
so before, whenever we would have double unders in the workout, I would have to go to the bathroom right before, and I would still, there would be issues during the workout.
Sure.
I would have to okay, let's stop because it just didn't make it. So now, about 3 weeks after having the treatment, I did double unders without any problems whatsoever. It was amazing. I was like, this is amazing, and I don't have to wear panty liners anymore, so it's awesome.
yeah.
Yay.
So.
I know, I actually had very similar issues to Megan, which I am a brand new mom, and I thought, well, maybe it'll take a couple kids, and it didn't. And I literally had to call my nanny to say, bring me some new pants at work, because I pushed myself a little too hard carrying something up the stairs. And it was super embarrassing. But I was so excited that, hey, we've got a treatment, I'm going to try it. And my big fear was I'm a bit of a weenie, and I was afraid it was going to hurt. And it didn't hurt at all. And I had pretty immediate results, which was super cool. So.
Yeah, definitely. When you guys all had kind of the stress urinary incontinence aspect of things, and then you had the other, which is actually what I did. I did it for the other reason, which is some, sexual dysfunction. Sorry, TMI, but, let's talk about it. So, I mean, I've had some hormone issues, and it affected me there. So I just recently had it, but can tell you that the things are heating up down south. So I'm pretty excited about that. I know it takes 6 months or something to see full effect, but I mean,
you're saying it even sooner?
yeah. I mean, when did we treat me? A month ago?
About a month
Yeah.
ago. The hard part is that, initially everybody knows the difference because you get some swelling.
Yeah.
And, but really I didn't have any downtime. There's really no downtime. I kind of almost forgot that I did it for a while until you're like, oh, wait a second.
Yeah, I'm excited to see how things continue, but I mean, we all had it for different reasons. It sounds like we all had a really good experience with it. So.
Yeah, I mean, I think a lot of people think that they're going to need that treatment after children, but it can be something that you get done
I haven't
before.
had kids.
I've never had
You've never had kids, so I mean, it's really for anybody.
The neat thing about Maureen is it has nothing to do, it has all these applications, but it's about stimulating your own collagen. So we do that a lot of places. We devise a stimulate collagen all over the place. So it makes sense that, okay, well, what if I basically refresh and stimulate new collagen in my vaginal area?
Yeah.
Then maybe things will improve, and that's exactly how this works. So
Yeah.
it's pretty cool.
I'm excited that we have this machine at our practice because a lot of women come to us for labiaplasties, and so this is something that they can do in tandem with that procedure.
But
That's a
not
very
only
good
that,
point.
I mean, to your point earlier, I mean, we treat how many breast
A lot
cancer
of breast
patients
cancer patients.
who
Yeah.
have had similar experiences with, can't do hormones, so obviously, things
Well, and you
can
have
dry
to,
up.
things change so much when you're going through breast cancer. I mean, a lot of women lose partial or all their breasts, and they're having to go through the kind of the trauma of
Yeah.
that. In addition to that, you have all these other things that happen, like what we talked about a few minutes ago,
Yeah.
down south. So
Right.
to be able to get that back is super important.
Yeah.
Yeah.
Well, I mean, obviously, I've never been through it, but since you've been through it, it's one of those things I can only imagine you feel like a lot of aspects of your womanhood are taken away,
Right.
right? You're going to lose your breast. That's huge. That's a huge deal. And now you're going to have issues there. I mean, I can't imagine, that's all the things that kind of make you feel like a woman,
Right.
And so,
Sexuality, your femininity, all of that.
all of
wrapped
it
into
sort
it.
of wrapped up into it. So to
Yeah.
have cancer come through and affect all of that, and then us, we've been doing breast reconstruction for years, but now we have something to sort of treat the other. So I mean, that's pretty cool. I like that.
Agreed. Cheers to that.
Yeah.
This is the cool part, is I just want us to be able to talk about all of this.
Yeah.
Yeah, it sounds like this is something that a lot of women can relate to, but a lot of women are maybe even scared to bring it up to their surgeon or their doctor. So what would you guys say to women that are maybe ashamed to talk about this?
Yeah, I mean, that's a huge point. I mean, who wants to talk about it? Nobody wants to talk about it, but you easily talk about it with your girlfriends, right?
Right.
So, here we are all with different backgrounds, different
Ages.
different situations, and we're able to talk about it. I think, I
Just
don't
not
just
to be afraid.
tell
Yeah,
them
don't
not
be
to be
afraid,
afraid,
Right, yeah.
There's, knock down the stigma, knock down the things that scare you about it. I mean, obviously you're one of the easiest persons to talk to, just in general, right?
Yeah.
I mean, so, if anybody can come in and talk to you about it, I think you'd be comfortable with it.